Yeah, so during the meeting, I talk about the maintenance therapy in AML. So today it's the new standard of care for patients with acute myeloid leukemia, not candidate for allo stem cell transplantation. We have several maintenance therapy for FLT3 mutated patients using ATK like Midostaurin today, and there is a lot of clinical trial evaluating other ITK like Gilteritinib in HOVON clinical trial and like Crenolanib in ARROW clinical trial. So all clinical trials are in first line and are ongoing, including maintenance therapy in FLT3 mutated AML. And for the other patients, there is oral Azacitidine based on the QUASAR trial. The oral Azacitidine increase the overall survival for patients treated with oral AZA as maintenance treatment. The oral AZA is efficient in patients with negative MRD or positive MRD. But there is a lot of discussion because today oral Azacitidine is authorized after intensive chemo, like 3+7, following by consolidation or not. But today, as we know, there is other intensive chemo like CPX351, for example. So we need to generate some data, I think, after CPX351, even if the NCCN guidelines recommend to use oral Azacitidine after CPX351. And maybe I discussed during my talk about Azacitidine injectable plus venetoclax. For some patients, some elderly patients, the treatment is too toxic to continue as recommended. So maybe we could discuss to maintain complete remission in this patient using oral Azacitidine. But today there is no data, so it's not a recommendation, of course. But maybe we have to generate some data also in this specific population.